Dear students, good morning to all. Today you are going to study one drug from nosode. I think you have already learned what is a nosode, what are the group features of nosodes, and what are the medicines, important medicine that come under nosodes, and what is the significance of nosodes in homeopathy. Sometimes this can be asked as an essay question. That is to write the general basic things like this: nosode, important medicine, group features, its significance in homeopathy, plus any one nosode that you are studied in your syllabus. So study ANTHRACINUM also. Today you are going to learn about ANTHRACINUM. And ANTHRACINUM, it is a nosode that is a product of anthrax poison, and it is introduced by Lux. See, this ANTHRACINUM is a very good remedy for septic condition. Almost all septic conditions it covers, that is carbuncle, gangrene, phalons, blood boils, etc. And its action is mainly upon the connective tissues, causing inflammation, and also in skin conditions, especially malignant ulcers, boils, and carbuncles. All these conditions soon resulting into sepsis. That is very much important. See the guiding symptoms. First point is septic conditions. The characteristic points being with intense burning pains. You have learned so many remedies having burning pains. Epis you have learned. Asab you have studied. In case of asab, the pain is ameliorated by warmth. Again, sulfur, phosphorus, sulfur, all these having burning nature of pains. As though in fire, and for septic fever with very rapid loss of strength and fainting. So here the guiding symptom of ANTHRACINUM is that it covers almost all the septic condition with burning pain and rapid loss of strength. Next, about hemorrhage. The peculiar feature of hemorrhage is that blood is black, tar-like blood. Tar-like blood is seen in Madorinum also, and very much decomposing. Almost all acid group remedies have the decomposing nature of blood that leads to very much offensive nature too. So here the hemorrhages are black, thick, tar-like, and rapidly decomposing. Next point, malignancy. It covers almost all malignancy condition also. Here also the terrible burning pain is characteristic, associated with great prostration. So all malignant conditions with terrible pains and prostration. Again, swelling of affected parts and which are bluish and verging into black. These symptoms you have learned in skin symptoms of lachesis also. Here the swelling, either of edematous swelling or glandular swelling, which are all attended. The skin has a bluish color changing to black is noticeable. Then regarding discharges, all discharges are ichorous. Ichorous means sacred nature and is offensive. Due to the decomposing nature of blood, the discharges all are of offensive nature and pus-like. Thick pus-like, ichorous and offensive are the nature of discharges. And regarding glands, all glands are swollen and indurated. So these are the guiding symptoms. So ANTHRACINUM is a good remedy for septic conditions with burning pains and with rapid loss of strength and fainting. Regarding hemorrhages, black nature, tar-like, blood rapidly decomposing. Again, for malignant condition with again the terrible burning pain and prostration. Then it is also very good remedy for swelling of after parts with the skin color bluish to black. All the discharges are very much acrid nature, offensive and thick pus-like, and the glands are swollen and indurated. So these are the guiding symptoms. Now let's see the various condition or situation it can be given. Especially sometimes it can be asked as an essay question, as a part of essay question, or the skin or indication of anthracinum in septic condition can be asked. So study the skin or septic indications of anthracinum. Anthracinum can be given for various skin conditions like gangrenous ulcers, malignant ulcers, complaints with ulcerations, phelon, carbuncle, erysipelas, etc., where these types are of malignant type with sloughing and intolerable burning. So the various skin symptoms are of a malignant type with much sloughing and burning. And when ALB or the best selected remedy fails to relieve the burning pains of carbuncle or malignant ulceration. So anthracinum can be given when the best selected remedy fails to relieve. This is again a feature of NOSOD, best selected remedy or the ASALB, because the symptomatology covers almost the symptoms of ALSALB. Even if the ASALB fails or the best selected remedy fails, we have next remedy, that is anthracinum. Then regarding hemorrhages, blood oozes from mouth, nose, anus and sexual organs, and the nature of the blood being black, thick, tar-like and rapidly decomposing. So the blood or hemorrhages are black, thick, tar-like, rapidly decomposing. So much offensive is that, and oozes from all orifices of the body. Again, it is indicated in septic fevers with rapid loss of strength, sinking pulse, delirium and fainting. Fever with loss of strength, prostration, sinking pulse, delirium and fainting. Again, it is indicated for phelon. Phelon, the worst type, that is with much sloughing and burning pain. That is malignant type of ulcers or skin lesions are the key point. Again, malignant pustules, black or blue blisters, often fatal in 24 or 48 hours. That is that much malignancy or the worst condition or the sinking condition is noticeable. So, malignant pustules which are of black or blue blisters. Again, it is indicated for carbuncle. Again, with the horrible burning pain, discharge of ichorous offensive pus. Also for dissecting wounds, anthracis have a tendency to become gangrenous with septic fever and marked prostration. And also it is indicated for insect stings, bite of insect, learned in Epis, Ladam, etc. That also, here also the symptom is there, that is insect. It is a remedy for insect bite with swellings, and the color of the skin from appears as a red streak from the wound map out of the course of lymphatics. That is, we can mark the course of lymphatics as a red streak in case of insect bite. Again, it is a remedy for septic inflammation from absorption of pus or other deleterious substances with burning pain and great prostration. So, any septic conditions, it can be applied. Again, even for animals, it is a wonderful remedy. For epidemic spleen diseases of cattle, horses and sheep also can be given. Again, for bad effects of inhaling foul odors of putrid fever or dissecting raw, poisonous by foul breath. Again, these symptoms is seen in Pyrogen, ALSALB, etc. For bad effects from inhaling in foul odors or poisonous gases, etc. Then Herring says that to call a carbuncle a surgical disease is the greatest absurdity. An incision is always injurious and often fatal. A case has never been lost under the right kind of treatment, and it should always be treated by internal medicine only. Herring says that we are considering the carbuncle or other septic condition for a surgical disease is not good, but it is better to give an internal remedy like anthracinum, because anthracinum can cure or remove almost all malignant conditions having the characteristic features. Then these are all about the skin symptoms or the septic conditions of anthracinum. So it is an important remedy indicated for all skin conditions almost of malignant type with sloughing, burning. And when arsenical azal or the best selected remedy fails, we can consider this anthracinum. Then hemorrhage of anthracinum are black, thick, tar-like and rapidly decomposing in nature. Again, it is given for septic fever with rapid loss of strength, delirium, fainting. Again, it is given for phalon. Almost all skin condition, phalon. The worst is type is sloughing, pain. Then malignant pustule with the color changing from blue or black, which is very much fatal. Again, for carbuncle with the characteristic burning pain and discharges often occur as offensive. Then again for wounds become gangrenous with septic fever, with much prostration. Again, a remedy for insect bite with where we can mark out the lymphatic course of lymphatics by a red line. Then for all septic inflammation due to the absorption of pus and is also associated with the burning pain and great prostration. Even given for disease of cattle, that is for epidemic spleen disease of cattle, sheep, horses, etc. And the main also can consider as a remedy for bad effects from inhaling foul gases. And Herin says that we can give or control almost the septic or malignant conditions by anthracinum if the symptoms correspond. So these are all about the septic symptomatology of anthracinum in sepsis അല്ലെങ്കിൽ skin conditions or study well the skin condition or septic indication of anthracinum, or it can be asked as a part of essay, the nosol. So to compare this remedy, it is similar to AS. Already said that whenever the ASAB or the indicated remedy fails, we can consider this anthracinum. So but to compare the symptoms of ASAB has burning pain and the discharge is scanty, offensive, ichorous in nature, and the person has much prostration is there. And the etiology also, it is a remedy for bad effects of from dissecting wounds, anthrax poison, etc. But here, in case of ASAB, the burning pains is ameliorated by hot application. That much. But in case of anthracinum also, there is much burning. And if the ASAL fails, we can consider anthracinum. In ASAL, there is also restless and thirst. Patient is much thirsty, and time modality, peculiar time modality also there in case of ASAL, that is 1 to 2 AM and PM. Then next about carbolic acid. In carbolic acid also there is intense terrible pain, but the character of pain is that comes suddenly, lasts a short time and disappears suddenly. And all acids are generally have much weak or prostration. Here also in carbolic acid also the patient has much profound prostration and offensive nature of discharges, very marked. Even in the breath feels offensive in case of carbolic acid. Then wounds with sloughing, and it is remedy for malignant scarlatina, etc. Then about lacosis. Lacosis, the side affinity left-sided nature, and it is a remedy having hemorrhagic diathesis, the peculiar nature of blood. That is, even the small wound bleed easily and profusely, and the character of blood being dark, non-coagulable. Whereas in case of phosphorus, the blood is bright red, non-coagulable. Here in lacosis, the blood is dark and non-coagulable. And again, it is given for bad effects of poisonous wounds. And the appearance of the skin, the peculiar appearance is that boils. It is a remedy for boils, carbuncle, etc. with intense pain, malignant pustule, etc. And the skin appears dark, bluish, purple appearance. And also it has a tendency to become malignant. Then about Achillicore. Achillicore, it is mainly for gangrenous condition, and there is also burning is there, but the burning is aggravated by external heat. See, in case of arsal, burning is ameliorated by heat, but Achillicore is aggravated by heat. And the boils are very much painful, and they mature and heal very slowly in Achillicore. Next about Pyrogen. Pyrogen, again a remedy for septic fever, where the chill begins between the scapulae and the temperature suddenly shoot up to 103, 106, and similarly the pulse rate also has a hike to 140 to 170. Then another remedy for septic condition is Tarantula cubensis. Tarantula cubensis is considered as a remedy of toxemia. Here also there are malignant ulcers, carbuncles, gangrene, abscess, boils, phelons, etc., where the affected parts are bluish color and the patient has much atrocious burning pain. Then I have said that if the burning pain or the symptomatology covers similar to us, and if it fails, we can consider anthracinum. If anthracinum also fails for the terrible pains, especially in case of cancer, etc., we can consider euphorbium. Euphorbium, that is given if the anthracinum fails. So these are all about anthracinum. Study well. Can expect for essay as a part of essay or simply as a short note or short answer as anthracinum in septic condition. So these are all about anthracinum. Now I have only one remedy to complete the drug from the allotted drug list, that is on hydrocodone. So after completing this hydrocodone also, there will be continuous class, especially not class, there will be test papers. So after completing this hydrocodone, our revision starts. So study well the portions. Thank you.